Tonight, the big question is our COVID-19 curve flattening? The Ministry of Health says it's still too early to tell, and we still have a long way to go. However, another important indicator, the test positivity rate stands at 7.9%. It has steadily been increasing from 2% at the beginning of the outbreak in March. This increase points to an acceleration in the transmission of disease. Dorcas Wangira reports on the evolving COVID-19 trend, even as 426 more tested positive for COVID-19 in the last 24 hours.
6 months into the pandemic, Kenyans have had to adjust to a new normal, looking forward to when we will have a flattened curve. Flattening the curve simply means slowing the spread of the COVID-19 pandemic so that the highest number of people requiring care at a given time is reduced and the demand for healthcare does not exceed the existing capacity. This also means daily reduced infections. Test positivity rate is simply the fraction of tests that come back positive, presented as a percentage. You divide the number of positive tests with the total number of tests. But what is the evolving COVID-19 trend telling us?
The current positivity rate in the country stands at 7.9%. And over the last 34 weeks, this positivity rate has steadily increased from an initial 2%. Again, if we look at the change in positivity rate from the beginning of this pandemic to where we are today, it points out that the curve is not flattening. And this increase points to an acceleration in the rate of transmission of the disease.
Best understand test positivity rate, you can use the analogy of a fisherman, his fishing net, and the fish that he catches. If you cast a wide net and catch many fish, it tells you that there's still more fish to be caught. If you use a large net and catch very few fish, it tells you probably that all the fish that need to be caught have been caught. Likewise, the net symbolizes testing. A large net would mean more testing. So if you test more people and find many positive cases, it likely tells you that more people are still positive who need to be tested. That is a high test positivity rate. On the flip side, if you test more people and find few cases, that gives you a low test positivity.
WHO advises a 5% test positivity rate or lower for at least 14 days as a measure of decline in infections. Kenya's COVID-19 trend is an evolving one. It is widely similar to countries which first reported infections of the SARS-CoV-2 virus. At the onset, there were very few cases and low transmission. Kenya's curve started to steadily rise from the 17th week. The same curve also observed a plateau between week 28 and week 31. NAIROBI County has registered the highest caseload after restrictions were lifted since July 6th. 59% of the country's cases are in Nairobi County alone. The other top 10 counties with high caseloads include Kiambu, Mombasa, Busia, Kajiado, Machakos, Mombasa, Nyeri, Garissa, Migori, Nakuru, and Uasin Gishu. Kenya recorded 426 new positive cases from 5,158 samples in the last 24 hours. This now brings to 31,441 the number of positive cases from 407,610 cumulative tests. 257 patients have recovered from the disease, bringing the total number of recoveries to 17,869. 10 fatalities have been recorded, bringing the total fatalities to 516. 3 were community deaths of young people aged 30 and below. So, what will it take to have a lower test positivity rate?
Important to maintain all these measures that we put in place, and this is what is going to help us ensure that our positivity rate is less than 5% over the next 14 days or whichever time that comes, that we can be able to clearly state that our curve is flattening.
If we let science and the numbers speak, we cannot relax or let our guard down. Dorcas Wangira, Citizen TV, Nairobi.